What are the causes of lower back pain in the gym? I want to kick this off with a story, and I hear this from so many patients. So, a patient that comes in, the lower back hurts, right? And you're like, you know what, Dan? I'm squatting. I keep on getting this low back pain. I think there's got to be something wrong with my technique. I've watched a few exercise videos. I try to keep my spine in neutral position. I don't know what the deal is. I think there's something still wrong with my technique because my back continues to hurt, right? And we just have to educate these patients because they've somewhere along the line, they've got the idea that technique is the only reason why their back can be painful in the gym. We know that's not the case. All right. So I want to go over some specific causes of lower back pain in the gym. And here's the thing: injury onset is complex and multifactorial, right? There's a lot of reasons why your back can get hurt in the gym. And I'm extrapolating some of these reasons why people get hurt in the gym from other sports injury research. Unfortunately, we don't have a ton of great research just in a weightlifting population. So a lot of this is coming from the sports world. And of course, you can go check out all of these references. They're in the show notes, right? But take this with a grain of salt because it's not coming from just the weightlifting population. All right. So the big one that potentially can cause a lower back injury in the gym is looking at total volume of training and also spikes in volume, right? So a spike in training volume is essentially having too much training volume in a program. This could be over the course of a week, over the course of a day, over the course of a month. Basically, more work for your back than what the back is currently used to. All right. That's referred to as a spike in training volume. Okay. Now, here's a couple places where the medical literature has shown this to be true. So, if you introduce a squatting, deadlifting, or Olympic weightlifting program too quickly, so basically you're not prepared for a given program and you jump straight into it, that can cause an injury. Okay. So, I see a lot of folks that are doing a traditional strength training program and all of a sudden they incorporate, let's say, a hatch squat program, right? Or some sort of Smolov training program. So, you go from squatting once a week heavy to squatting 4 to 5 times per week. Okay. So, you just quadrupled your training volume. And over the course of time, that can lead to an injury, right? The other thing you'll see in the medical literature is being a novice trainee. So less than 6 months to a year worth of training experience. And this is coming from the CrossFit, some of the CrossFit medical literature. So if you haven't been training for very long, it's just a good chance that you're going to get hurt because you're probably not used to or prepared for the training volumes that someone who's been training for 4, 5, 6 years would be, right? So it comes down to your training history or sports background. The other piece that can cause problems is a lack of consistency with training. And this is especially true with CrossFitters. So let's say that you come in 3 to 4 days per week, usually, right? And usually on those days, you're training snatching, deadlifting, and let's say squatting. All right. But you miss a few days or your schedule changes, and now you're coming in during a different day of the week. And now you're not deadlifting, but you're practicing clean and jerk, right? But you're not used to practicing clean and jerk because your schedule just shifted, right? And you're not being consistent with your training. So now you're being exposed to a different lift that you haven't prepared for, and you just have an increased likelihood of getting hurt. So it's important you're very consistent with your training to avoid low back issues. And the last piece is excessive training volume. Okay. So too much training via sets, reps, and frequency. There's a finite amount of work that the low back can tolerate. And that's going to be based on the individual as well. So some folks can tolerate a lot of stress. Some folks just can't. All right. And here's the thing: the more exposure you have towards stressful exercises towards your back, the more likely you are to get hurt. So if I squat 17 times a week, I have 17 opportunities to get hurt. Whereas if I just squat 1 time per week, I have less opportunities to get hurt. Okay. And this can mess with people's heads because we know fitness is protective. So basically, if I do a lot of squatting, my body adapts to squatting and I'm a little less likely to get hurt. Okay. So per hour of time I spend, if I'm used to squatting, I'm a little less likely to get hurt, right? But if I'm squatting 17 times a week, that's a lot of opportunities to get hurt compared to that person that maybe only squats for 1 hour per week. All right. Hopefully that makes sense. What other potential causes do we have? So excessive training loads, which is basically using more weight than your spine can handle. All right. And this theory is all over our medical literature. Although I would really like to see some specific studies that are comparing folks that are doing, let's say, over 90% of their 1 rep max frequently in training versus under 90% of their 1 rep max over the course of time and see what happens to lower back. It makes total sense that using too much weight can cause an injury, but I really like to see if there's a difference between doing 5 rep max plus training or doing, let's say, 10 rep max or less than 10 reps over the course of time, if that has any difference in terms of injuries. The other piece is lack of coaching and or poor technique, right? And this makes total sense. So if you don't have someone guiding you through a training program, talking to you about sets, reps, frequency, when to push, when to back off, you're a little more likely to get hurt, okay? And technique will certainly play a role, although that is a very nuanced discussion for another day. The other piece is having poor recovery. So if you don't have good nutrition, good sleep, good stress management, or lack of recovery days between intense sessions, you're a little more likely to get hurt. And the other piece is having mobility issues, creating more stress on the spine. And we'll talk about this a little bit later. And I think it's important to understand that globally, in terms of our medical research, flexibility is not one of those things that helps to decrease your risk of getting injury. Although I certainly see cases where mobility is very important and could be a potential reason why I get hurt. And we'll talk about this later. And the last piece is not taking prior low back injuries into account. So if I hurt my low back, let's say 6 months ago, I'm a little bit more likely to have low back pain in the future, right? And this is unfortunately just something that, is inherent with low back pain. If we have had a prior injury, we're more likely to have a future injury, all right? Some other potential causes are psychological profiles or characteristics, and this is actually super interesting. This research is mostly coming from athletes, university athletes. Again, check the show notes if you want to see the references. So having a high athletic identity can increase your risk of injury. So if your whole sense of self-worth is wrapped around being a high-level athlete, then if you end up getting injured, this is a major threat to your sense of self, okay? The thought here is that you're more likely to deny pain, right? So your coping response is just to ignore that you have pain, because if you end up having pain or an injury, that's a major threat to your sense of self. Okay. So your sense of self-worth completely wrapped up in being an athlete. If you get an injury, that's a major knock on that. So more likely to just ignore the pain and work through it, which can lead to more problems over the course of time. The other psychological characteristic that can increase your risk of injury is perfectionist, right? So if you're a perfectionist, you're a little more likely to push through pain to have more sets, more reps, that perfect workout, whatever it is. And I think this is a double-edged sword, because if you're a perfectionist, that's going to help you to succeed over the course of time, but it's also going to potentially push you towards getting injured by doing too much, right? And again, you might be a little more likely to use denial as a coping strategy, just because it's so important that you get things right from a training perspective, that you're more likely to push through that pain, push through that injury, right? And the last piece that is related to injury is working through a less severe injury. And this research is coming from the soccer world, right? So essentially what they're looking at is folks that had a non-time loss injury, which means that, let's say I'm playing soccer and I hurt my hamstring, but it's not that bad and I can work through that. That would be a non-time loss injury. It doesn't keep me out from playing or training, right? But what happened with these folks is that if they pushed through some pain, it was more likely to cause a time loss injury, which essentially means that the pain wins. So you push through pain to the point where the pain gets worse, and now you can't play anymore. All right. And this makes total sense to me. So if you're in the gym and you're working through pain, oftentimes it does get better, and sometimes it gets worse. And sometimes it gets so bad that you have to stop, even more so. And we just don't want that. Okay. So here's the thing. I have an entire mini course. It's called the Fitness Pain Free Mini Course. And we go A to Z about these specific causes of pain in the gym. I have one lecture. It's called 7 Reasons Why People Get Hurt in the Gym and What to Do About It. I also have a really nice infographic that goes along with it. So if you want to go deep on this topic to see why people are getting hurt in the gym, and also some ways where you can prevent injury in the future, definitely click on the link in the show notes. All righty.